Right. All right, we're live. Good morning to everyone joining us from Southeast Asia, and good evening to those from the US, including my DC Sports bobblehead collection that have decided to sit in on the event. My name is DeAnna, and I'm the Professional Fellows Program Manager here at ACYPL. Normally around this time, I would be leading the ACYPL team in preparations for the Fall ProFellows program, but seeing how that is not possible, I'm thrilled to be co-moderating today's first ACYPL International Town Hall with Mr. Norman Goh, who I greatly admire. We're also joined by a panel of ACYPL's Malaysian alumni who are involved in Malaysia's legislative efforts, policy, politics, and more broadly, Malaysia's story. I met Norman in 2018 when he traveled to the US with ACYPL and spent 1 month as a fellow for the Pioneer Institute in Boston, Massachusetts. Currently, Norman is a freelance journalist and a producer of the Perkara Minggu Ini podcast, which in English is Talk of the Week.
All right, thank you, Pete. So it's great to see you again, Pete. Selamat pagi, or good morning to those who are following the session in Malaysia, and good evening to our friends in the US. It's a great pleasure to be here. As mentioned by Pete, I was a social media editor and journalist with Malaysia Kini. It's an independent online news organization from 2014 to 2019, prior joining the federal government as the Special Functions Officer to the Cabinet Minister. Right now, I'm a freelance journalist and producing my weekly podcast on current affairs and politics on Bicara Minggu Ini. Bicara Minggu Ini means Talk of the Week. So it has been 6 months since COVID-19 outbreak began, spreading across the world that led to a serious pandemic. Some countries jumped straight into action and took strong measures fairly quickly to contain the situation. And today, we are also seeing how they're managing subsequent waves of new cases. It's not just in Southeast Asia, Asia Pacific, it's all around the world. So today, we'll be discussing the Malaysian government response to COVID-19 pandemic, beginning with an overview of the situation from the early days of the outbreak in Malaysia to present day. So we'll move to the federal government response and the coordination with state governments of Malaysia, the economic effects, the overlooked impacts of the outbreak, and finally, we will look to the future and discuss the path forward in the face of a second wave and future pandemics. So I'd like to introduce our panel. We have 4 panels today. We have Su-Lyn, Afif, Rajiv, and Kelvin. So let's start with Su-Lyn. Welcome to the show.
Thanks, Norman. So I'm editor-in-chief and co-founder of CoBlue, which is a health news website that's based in Kuala Lumpur. We report on important healthcare issues and policies in Malaysia, and we also keep an eye on what's happening around the world. Even though we are just slightly more than a year old, CoBlue is quite widely read by the medical fraternity in Malaysia, in both the public and private sector. In the past month, CoBlue recorded almost 350,000 page views. So it's pretty cool.
Yeah, thank you very much, Su-Lyn. So next we have the Honorable Dr. Afif Bahardin. He's a doctor himself. So would you like to introduce yourself to the followers today?
Hi, good morning and good evening, everyone. I'm Dr. Afif. Currently, I'm the Penang State Legislator. I used to join ProFellows in 2019. And besides being a medical doctor myself, currently I'm heavily involved in the charting on and building up the policy for the federal government, as my current position is the special advisor to one of the senior minister in the current cabinet.
Thank you so much, Afif. So let's move on to the Honorable Rajiv Rishyakaran. He's a state legislator in the state of Selangor. Hi, Rajiv.
Hi everyone, I'm Rajiv. I'm a state assemblyman in Petaling Jaya, which is right next to the capital, KL. And I've been in politics for the last 12 years. And this has been definitely the hardest hitting economic and health crisis that we've ever seen.
All right, thank you so much, Rajiv. And next we move to our final panelist. And he's a federal legislator, a member of parliament from Bandar Kuching, located in East Malaysia. Welcome, Honorable Kelvin Yii.
Hi, my name is Kelvin. I'm a trained medical doctor, and I have a second degree in law and a master's in medical law. So something that is very interesting. This is one of the biggest health crises we have faced globally, and glad to share some of my thoughts with you all.
All right, thank you, Kelvin. So we move on to the first part of our program today, and let's look at an overview of our COVID-19 situation in Malaysia, right? And when all these things started. So move on to our first panelist, Su-Lyn. You have been covering Malaysia's response to the COVID-19 pandemic since the beginning. Will you provide us with an overview of the situation from the beginning until now? So we started since January, especially for our non-Malaysian viewers, our friends in the States, probably in the UK and elsewhere in the world. We are not really familiar with the details of what's happening in Malaysia and how the government respond. So take it away, Su-Lyn.
Sure. Okay. I'll just talk a bit about the lockdown impact and also what exactly Malaysia did to flatten the curve. If we can pull out a presentation now. Yeah, just go to the first slide. So what Malaysia did was that we had a strict lockdown for 7 weeks from March 18 to May 3rd. We called it the Movement Control Order, or MCO. So basically, this was done nationwide. It didn't matter where the hotspots were at a particular time. People were not allowed to move beyond 10 kilometers from their house to buy daily necessities and to seek medical treatment. And during this time, we flattened the curve. Flattening the curve just simply means that we slow down the rate of transmission so that we don't get a surge of cases that overwhelm the capacity of the healthcare system. So meaning that we have enough beds and ventilators to cater for incoming patients. And it's worked. So since July 17, we have had daily cases. So after the MCO, cases dropped to single digits, but then for the past couple of weeks, cases went back up, but it's still pretty low, double digits, although we've had new clusters. And you can see here our deaths per million population and case fatality rate compared to other countries. Malaysia is doing pretty well, right? And right now, so we're back to double digits, but it's still, I think, about fewer than 20 new cases a day. We had 10 local transmissions yesterday. The key point though is, I want to stress, in this pandemic, we have to test, trace, and quarantine. We should not follow Trump's approach, as you can see, because he says that the reason why the US has a lot of cases is because they do far more testing, which is true. So the more we test, the more cases we get. We can move on to the next slide. So when it comes to testing, you can see that on July 5th, we had testing capacity of 37,000 tests. But for some reason, Malaysia, we only tested about 3,000. And then if you can see on the table on your right, an average of about 6,000 people sampled a day. So, and if you, can you click some more? And you can see our foreign worker testing also, it's not a lot. So in 2 weeks in July, we've tested only less than 4,000 migrant workers. So that comes up to about 280 per day. And Malaysia has at least 2 million documented foreign workers. So if we take a 1.7% positivity rate, does that mean 34,000 are possibly infected? And that's not even taking into account another additional 2 million undocumented workers. So when you look at Singapore tests about 114,000 people per million population. Malaysia, we test about 30,000 people per million population. So that's 3.8 times lower. And although Singapore has been reporting hundreds of new cases every day for the past few weeks, but the number of cases in their community are really low. So yesterday, Singapore said that the number of community cases dropped from about 4 cases a day to 2 a day. And more importantly, the number of unlinked cases in the community. Unlinked means cases where you're not sure how they got infected. So the number of unlinked cases in the community in Singapore also dropped to just 1 a day in the past week. Malaysia, on the other hand, although our cases are below 20 a day, but a lot of our community cases that we've been reporting are unlinked. We have no idea how these people got infected. We picked them up through medical screening at medical facilities. We have picked up cases in 3 separate prisons in 3 states, which means that the virus is still in our community. So I think Malaysia could expand testing and make it more inclusive. I mean, we have 7,000 general practitioners in the country, and they complain that they have been totally sidelined from the COVID fight since day one. So why can't we use them to do more antigen rapid tests to, help monitor cases in the community? Can we move on to the next slide? Yeah, so I'll just talk briefly about the impact of the lockdown on health. So although the lockdown was successful in flattening the curve, but it didn't come without costs. So there were two areas. So in cancer, cancer groups say that we may see a 3 to 6 month delay in treatment because a lot of the hospitals that provide cancer treatments are also the same hospitals treating COVID patients. And if you look at our cancer numbers aren't great. The latest cancer report for 2012 to 2016, cancer deaths actually rose, late stage cancer detection increased. So when you have a delay in treatment, what we are most likely going to see is that people who may come in with stage 1 cancer, but because of the 7-week lockdown and subsequent movement restrictions, their cancer could probably progress to the next stage, which means poorer survival rates. And also because of the lockdown, as it is, many Malaysians don't do enough cancer screenings. We don't do enough mammograms, people hardly go for pap smears. So what more during the lockdown when they probably wouldn't do these things at all. We also saw a surgery backlog. So a study estimated almost 152,000 surgeries will be backlogged in Malaysia this year, which means they estimated an 11-month clearance time. So 11 months just to clear the backlog. We also saw a drop in childhood vaccinations, important childhood vaccinations like the MMR, chickenpox, and disturbingly, even after the lockdown was lifted in May, the MMR vaccination rates did not significantly improve. Yeah. So yeah, that's about it.
Thank you, Su-Lyn. Moving on to federal policymaking and the coordination between the federal government and the state government, my first question is for Kelvin. Could you introduce us to the public health policymaking process, who the main actors are, and what are their roles?
Thank you so much, Pete, for that question. I think in terms of response towards the crisis, I think there are different levels of players. Of course, it involves the executives, and of course, the other branch would be the legislative. I think I'm going to expound more on the executive first. I think the executive, as mentioned, there is the federal government. In Malaysia, we are very centralized or very powerful central government in comparison to like the US. The other players, of course, the state governments, and the last layer is actually the local government or the council. And they also play a very important role to implement and to administer the aids, especially, and also with dealing issues of business licensing. So on the federal level, health matters is a federal government issue. So based on our federal constitution, is a federal matter. So the Ministry of Health basically decides the main health direction of the country. And then the implementing officer or even issues of security and like, for example, as Su-Lyn has mentioned just now, the Movement Control Act, a lot of that is decided under the national, what we call the Majlis Keselamatan Negara, or in English, it means National Security Council, where they decide on the movement control orders and decide on certain restrictive interventions and stuff like that. Of course, all this will get the input of the Ministry of Health. And then after that, on each state level also have the state health department. Of course, majority of the policies are decided on the federal level, but each state is given certain level, especially like in Sarawak and Sabah, where I'm from, they have certain level of autonomy to tweak, to kind of adapt it towards the local context, and as well as as they know the ground better. And of course, there's also the State Disaster Management Committee under the National Security Council, as mentioned just now. They also have a certain level of autonomy to tweak it based on the local context and the local flavor. So the next, of course, is the local government, the council. I think this local government play an important role because they control business licensings. So when we have, for example, certain level of restrictive control orders like curfews and limited business hours, the local council actually play an important role, including enforcement. Like in Malaysia, one of the steps that was taken is a mandatory masking in public places. So the local councils also play an important role in terms of enforcement. So that's the executive. And then the other branch which I'm part of is the legislative in Parliament. Technically, laws concerning COVID should be passed in Parliament right now. But to be honest, in Malaysia, the Parliament was actually delayed, and I personally felt that it was delayed a bit too long. So right now, only yesterday I received the law, basically the Temporary Measures Act for COVID. This law is very, very important because during this time, we know it's not just a health crisis, it's also an economic crisis. Such law is important for protection, for example, contract obligation protection, tenancy protection, as well as protection for bankruptcy during this period. I've read through the bill itself. In my opinion, it's not comprehensive enough. We will need more in that bill itself. And of course, the economic stimulus package that I think most governments in the world has announced to help boost up the economy. So that's the brief overview of the whole players that have been part of this.
Right. Thank you so much, Kelvin, for your input on that. Because for your information, currently in Malaysia, there are two stimulus packages. One is called DeAnna, the other one is called Bahardin. These are the two of the things that have been started since the beginning of the year. So move on to the next panelist. We have Dr. Afif. You have been deeply involved in policy-making process for Malaysia's response to the outbreak. So in your experience, what were your main focuses going into the policy-making process, and what challenges do you face? Afif?
Thank you, Norman, for the question. As you can see, when we started off with the MCO at the initial part, there's a slight change in the government and also at the political sphere at that time. But as we progressed during the weeks and months prior to MCO, I think the government and the cabinet, the three main focus that angle that they are looking at, three main things, which is on the health angle, followed by the security and enforcement, and also the third part is on the economic angle. So before we go in detail to all this, I think we have to first touch on the very difficult decision to implement, which is the movement control order. I think I agree with what YB Kelvin has mentioned. The act that has been used by the National Security Council was the Disease Prevention and Control Act 1988, which is Act 342, which is the federal government act that allows the federal government to impose certain measures in order to control the spread and also the extent of preventing COVID-19 pandemic. Firstly, the lockdown was not a popular thing, even across the globe. Back when we were first considering it in March 2020, you can see the resistance in certain countries, even in the US, between the US states and their governors, even to EU nations, and those who are considering the herd immunity approach. But regardless of what you may feel about the government today, the decision-making and policy implementation in regards to COVID-19 was and is still guided by the scientific evidence, which I will explain later. It may be difficult when the focus initially was about health, the idea of protecting the life of the citizen. But the second thing that really happens during that time when we were considering MCO is how we're going to make sure that the economic activity will be able to sustain and the people will be able to continue with their daily life, even with the MCO implemented. So the challenge was not only to get the public buy-in to allow MCO to take place, but also among the different departments, different experts within the government sector itself. They are proponents of strictly controlled movement order in order to curb the health effect immediately. But there are also those proponents from the economic side who feels that if a strict MCO has been implemented without considering the economic impact, will cause a more detrimental effect to the nation and the population in the future. So this is the challenge that the policymakers and also especially the government and the cabinet have to decide at that time. And finding out that balance requires a lot of engagement, requires a lot of give and take, and also to be able to argue and also to get the best decision to be made. But one thing that we've learned during the biggest challenge is that
almost 152,000 surgeries will be backlogged.
A lot of give and take, and also to be able to argue and get at that time when we wanted to have that decision being one of the challenges that once a decision has been made, because this is the first time of any government or any nation going through this kind of situation that we've seen. So in order to once you've made a policy or a decision, we have to monitor it on a daily basis or even to an hourly basis to see the effectiveness of that decision that has been made. So one thing that the challenge that we have is to be able to change it immediately if we feel that there's a need to change the decision that's been made. And it's also a learning process for everyone, not only for the people as individual, but also as a government in our decision-making process.
Thanks, Afif. YB Kelvin, what aspects of the response do you think were most successful?
I think most successful, I would give it to the Ministry of Health response, because I think the underlying principle that they follow by that it has to be evidence-based. So all policies that were done, even interventions that was done, it is purely based on evidence-based rather than impulsive decisions. I think one of the things that the Ministry of Health as well succeeded in doing was effective communications. The Director General of Health comes out on a daily basis, especially during the peak of the disease, to give a very comprehensive update of the situation and what the government is actually doing. And that has actually given a lot of assurance, a lot of confidence to the public, as well as to better equip them for compliance. So a lot of these decisive decisions, I think even the movement control order, as Dr. Afif pointed out, it wasn't a popular move. But then at that period of time, especially when we see a certain level exponential rise in March, the Ministry of Health advised the Security Council, and then they implemented the MCO. Of course, there were weaknesses in the early implementation, but I think that itself is good. On the side of the Ministry of Health as well, the management of COVID patients has been, in my view, exemplary. We have one of the lowest death rates in comparison to the rest of the world. I think we have about registered 125 deaths out of 9,052 cases, if I'm not mistaken, up to now. So management-wise, the health side, I think that has been our shining star in managing that whole thing. Of course, without saying there are weaknesses in terms of implementation at the start, especially. I think I'm not saying this to downplay the government's role, but actually for a lesson that we all need to deal with. I think at the beginning, especially on the health side, I think this is worldwide. There was issues with the lack of personal protective equipment, PPEs. Also, there was a certain messiness in mobilization of healthcare workers because the COVID hospitals are jam-packed. So a lot of doctors from different departments were actually mobilized to treat COVID patients. So they left a lot of gaps in different departments. So that could have been done faster and more comprehensively. And I think as Su-Lyn mentioned right at the beginning, one thing that I felt that the government sector, especially the health side, could have done is to rope in the private sector. They should form a unified healthcare network, and so that the private sectors could deal with non-COVID-19 patients while the governments and public sector focus on COVID patients. In that case, we can try to reduce the issues regarding, as mentioned just now, the non-COVID patients that are suffering due to the focus on COVID. And the last one, of course, is the weaknesses enforcement. I think one of the things that can be done better is communications. I think when MCO was first announced, the communications was actually very vague. So actually the next days were very messy. People didn't understand. And so it was very chaotic actually the past few days. So again, as I said, good communications will ensure better compliance. So the health side did that. So I think that's one of the biggest lessons that we can share with you all. Thanks.
Can I just say something in response
Sure.
to Dr. Yii and Dr. Afif? I think, now that we've passed the strict lockdown, so we may not remember really just how oppressive the lockdown was. Although the lockdown did result in us flattening the curve, but the way we did it was we brought in the military to enforce a public health crisis. And at the start, of course, as Dr. Afif and Dr. Yii mentioned, it was a bit chaotic because the government announced that the lockdown would happen 2 days prior, which sparked panic and caused people to all go back to their hometowns. But we can put that aside. But the fact is, throughout the 7 weeks, poor people were disproportionately victimized by enforcement authorities during the lockdown because we have a lot of informal workers in Malaysia. So when people were restricted to 10 km from within their houses, and initially the government didn't even allow you to move beyond 10 km to go to the hospital. Cancer patients were turned around at roadblocks, even though a majority of the major hospitals are located in the Klang Valley, and people from all over the country go to the Klang Valley to seek treatment in both the public and private sector. So people were getting fined, the maximum fine of $250. People were being sent to jail. They were being arrested. They were being chained and cuffed just for the offense of leaving their house or breaking movement restrictions. So that I felt could have been totally avoided. I don't think the lockdown should have been as strict as it was nationwide. I think we could have focused on the hotspots at that time, which were in the Kuala Lumpur and Selangor.
And so
Thank
don't
you, Su-Lyn.
mind me adding to that, Su-Lyn. Sorry. Again, we are discussing this as a lesson for all. I think we're also learning this, not to downplay the role of the government. But one thing that we really should have improved was our treatment towards our migrant workers, especially. There was a lot of xenophobia targeted at them, and the government actually put them in non-ideal situations where infectious disease such as COVID can spread. So a lot of blame was thrown at them when, in my view, they got it from the locals. It was a local transmission. We threw them in a detention center and it spread among them, and we started blaming them. So they should have been treated with dignity and given proper care for that as well.
All right, thank you, Kelvin. So I think for our listeners out there in the States, I'll just give you a heads up what it means by some of the panelists that mentioned about MCO, EMCOs, and all these abbreviations. MCO here stands for Movement Control Order. And then you have enhanced movement control that I think what Su-Lyn has mentioned earlier. I think sometimes you see some areas were cordoned off, military as well as police were brought in and things like that. And in the later phases, and we have the conditional movement control order. And currently we have what we call as the recovery movement control order. So we'll move on to Afif in the next question. You are a state representative and you're also part of the government right now in the federal level. You're a public health expert who work closely with the federal government on COVID-related planning. Can you discuss the relationship and the coordination between federal and state agencies in crafting and enacting COVID policies? So we bring in some questions as well as some of the issues that was brought up by Kevin and Su-Lyn. So Puri, you want to share a little bit on that?
First of all, I think we have to agree that when we first faced with these COVID-19 challenges, it is a war by itself against unseen enemy, which is the virus itself, and we do not know how it's the disease pattern and the spread of infection. So everyone is on the learning curve of how they will be able to come up with a better policy and also to make a better decision in order to test and also to be able to help prevent further spread of the disease. As we can see, Malaysia experience, I do agree there are some hiccups and also challenges that we face, but with the coordination of the federal government and state government and the state agencies has actually allowed us to be able to achieve what we have achieved today. It's not only about recognizing the effort by the healthcare frontliners, I would say, and also the security frontliners, but we also have to acknowledge the economic frontliners who has been on the ground from day one in order to make sure that there is continuous supply of food, supply of needs being produced for the people. That's why when we first started off during the MCO, the very first week when all the factories were closed down, we noticed that there are quite a number of essential food that is needed by the people, that is required by the people daily, cannot be produced. This is what have been taken into consideration when, as the days goes, when the decision has to be made to reopen some of the sectors, the essential sectors, during the COVID and during the MCO period. So if you can see, during the first few weeks, there's always a talk about opening up certain economic sector, certain businesses, and the debate has been tremendously debated on social media, in the public forum, and when we first coined the term the new normal, the approach to new normal, was you received a lot of I would say negative remarks and comments, and as those saying that the government doesn't care about the life of the people by opening up the economy. But now everyone is talking about new normal. So as you can see, what the federal government has been able to do during the MCO period is that when we monitor the sentiment on the ground and also to get the real-time feedback from the people, we realize there are certain other measures that need to be implemented, especially to help and ease the burden of the general public when they face the challenges during the MCO. One of it is the introduction of Bahardin, which is the cash handout programs that has been implemented during that period. To answer Su-Lyn's question about how the poor has been highly affected, the daily wage earners who also face these challenges when businesses are closed. So the federal government decided to give out cash handout to this sector of community. And also I noticed some of the state government also decided to give out cash handouts in order to help them face the challenges during this period. And as you can see, I would also like to applaud the general public, especially the people of Malaysia, who has been a very good Samaritan, who has always come up with ways and measures to help their neighbors. And you can see there's a spirit of community engagement where they do get in touch with the local communities within their residential area, their neighborhood, who might be have left out without food, and people came out and also engage and allow and help them out. So this is things that happen during that period. And as you can see, as I mentioned earlier, the federal government has the capacity to implement a lot of policies because of the structure of authority in Malaysia. We have the three-tier government, we have the federal government, the state government, and the local government. But using the National Security Council and also the Disease Prevention and Control Act 1988, the federal government are able to implement and impose all of the policies even at the grassroots level. Because most of the agencies, especially health and security, is under the federalists. So most of the agencies are already under the federal government. So in matter of coordination, I do agree with Honorable Kelvin, Dr. Kelvin, on certain issues on communication and miscommunications. But I think as days pass, we've improved that, especially when people get to understand more on how the policy can be implemented. And to a certain degree, the federal government and the National Security Council allows the state government and the local council to even enhance further the policies to a certain level that they feel will suit best for them to implement, and also to make sure that they be able to prevent the spread of COVID-19 in their particular state and their particular region. And at the federal level, I think now with all the stimulus package, and also the focus now is about looking back how we can reignite and also rejuvenate the economic sector. There's a lot of measures, short-term, long-term, and also mid-term that we are implementing that soon will be presented, I hope, in the 2021 budget, and also the second stimulus package that most probably will be presented also in order for us to help the citizens, especially who are affected during the COVID-19 period.
Thank you, Afif. Rajiv, as a state legislator from Selangor, how were the responses from the federal and state governments from your point of view? Can you briefly share with us the roles they play for Selangor on the ground?
I think Kelvin covered this quite well in terms of the jurisdiction of the federal and state governments. And in fact, unlike Sabah and Sarawak, Selangor government has even less jurisdiction when it comes to public health. So most of the policies have to be made and were made at the federal level. The movement control order, the details of what businesses had to be shut down and what businesses could reopen. But I think where Selangor really stepped in was in the initial days, because when people were told that they had to stay at home and they can't work, a lot of people were trapped without food, without money, and without the ability to continue living. And this is where Selangor's responses were immediate, as in the first day itself, food was being dispersed to homes, to families who really needed it. And that continued for the first couple of weeks. Now, the Prihatin was good. The federal government had a duty of care to give these cash handouts to the families that needed it. Unfortunately, it came late. It came weeks after the lockdown started. It should have been done in the first week itself of the lockdown, because the federal government ultimately used a database of 8 recipients that was already available on hand. So they should have dispersed the money to the bank accounts of these people from the first week of the lockdown and not have waited a few weeks later. So I think that's where Selangor really stepped in to help its people.
And on that part, because later on we will have the economic effects and outbreak and the response itself. So we're gonna jump back to Afif again, because we would like for you to share, you had the opportunity to work closely with the public health professionals in the US during your ACYPL exchange. So broadly speaking, can you tell us about the differences and similarities in the two systems from your perspective, and how you think those contrasting systems affected the response from each country?
I think I had the opportunity to be in Wisconsin last year with the Department of Health Services during my fellowship program. It is actually a two different system as a whole compared to Malaysia, where we have a very centralized healthcare system and policy making, where the decision and most of the programs and the jurisdiction and quality comes from the federal government, which is coordinated by the Ministry of Health, even at the state level. So this is the vast difference compared to the US, where majority of the states have their own autonomy on healthcare services and also on public health. So it's only the matter of between the federal government in the US and the states. It's about funding issues, where the federal government will prepare some funding, but it will be decided by the state how they're going to use it. Whereas in Malaysia, the funding comes from the federal government. The decision made by the federal government. If the state government decides to implement other measures or other programs, we can cooperate with the state departments, the state health departments. They can come up with their own funding of that particular state. For example, at Selangor and Penang, they come up with their own funding to fund some of the projects in order to do some tracing, contact tracing, and also. But I think the main difference is that it's more centralized in Malaysia compared to in the US. So at the decision level making process, it is slightly, I wouldn't say it's easier, but more conducive to have a more comprehensive policy being made during the MCO period, when you have a centralized system that allows everyone to talk in one voice and also to move in one direction, compared to what the US are experiencing now.
Right, thank you so much, Afif. I think I'm going to throw in one question from our participants that already signed up earlier. So I'll throw this question to Su-Lyn. So how do Malaysians view the US response to COVID-19 pandemic? So do you think COVID-19 situation in Malaysia is worse than what the government is reporting? Maybe others like Kelvin and Rajiv want to throw in a little bit. Let's start with you, Su-Lyn, just a little bit.
Well, I can't speak for all Malaysians. I'll just speak for myself. The US does seem A bit strange, I guess, because you have a president that doesn't seem to want to listen to science, and you also have a lot of Americans who don't want to follow basic protective measures like social distancing or wearing a mask. I think Trump only endorsed the mask quite later on, although better late than never, right? And in Malaysia, so the difference between Malaysians and Americans is that Malaysians had and still have very high compliance to government measures. During the lockdown, we had very high compliance. Now, although people and politicians are complaining about Malaysians supposedly not following safety measures anymore, I don't think that's I don't think that's really fair. I think our compliance is still very, very high compared to other countries. As to whether the Malaysian situation is worse than what's officially reported, I can only say that the more we test, the more we know. So if you really want to find out if you really want to find out the actual COVID situation in this country, we can do antibody testing to see how many people were previously infected. So there was a random sample of 20,000 residents in New Delhi that found almost a quarter had antibodies to the virus. But New Delhi only officially reported about 124,000 cases in their 28 million population. So there were millions more who were actually infected but were never discovered. So we may find the same here.
Yeah, thank you so much, Su-Lyn. I think later on, our Honorable Dr. Kelvin Yii will share his experience because he was found positive with COVID-19 and he had to stay in a hospital for 14 days. And later on, he got quarantined again for the exposure. So we move on to our next part of our session will be on economic effects of the outbreak and response. So I'll go to you, Rajiv. So coming from Selangor, Selangor state is one of the 14 states in Malaysia. So it's the economic powerhouse of Malaysia and also one of the worst one of the states hit hardest by the outbreak, and outside KL. So what areas of the economy have been affected most? What is the government doing for businesses, both federal and state, to avoid foreclosure? And in your view, what more can be done?
Well, yes, definitely there's going to be a huge impact when most businesses were told to shut down during that few weeks of lockdown starting in March. And the federal government gave an estimate of 2.4 billion ringgit of GDP loss every day the lockdown continued. So there definitely is a huge impact. So many businesses were in trouble from the get-go. And this was not because they had lousy business plans or the market, they couldn't adapt to market changes. This is just simply because the government said you have to close your doors for at least 2 weeks, and then it was extended 4 times. So for 8 weeks, they had to shut down. But during this period, they still had to pay rent, they still had to pay salaries, they still had to pay leasing payments for machines, equipments, and whatnot. What would have been really helpful, looking back, and since this is a session to reflect and learn, is the moratorium that the government put in place very quickly for bank loans. That was great, and I give them credit for it. But similar moratoriums should be put on other things so that businesses could be frozen in time on 18 March when the lockdown began, and they wouldn't have to come to a point where they have to use up their reserves and eventually shut down. So many businesses suffered greatly. Some had the financial muscle to tide over the period of lockdown, and many others did not. Some could have survived the first lockdown, but do not have the reserves to survive a second lockdown if COVID cases spike again in the next few weeks. So I think this is where the COVID protection bill should have come in from the beginning itself, how Singapore put in place that law through Parliament from the beginning itself to protect against rent and other creditors to preserve businesses. Now, why is it so important to preserve business, especially the SMEs? Is because it's the source of jobs, and a lot of honest Malaysians, honest, hardworking Malaysians are out of job because of this. And so we could have done more to protect businesses, and I think that's one of the shortcomings from the federal government. I think on the health side, they did well to respond very quickly. The health DG was very responsive and communicated very well, and I think most Malaysians appreciated that. But we could have seen more coming from the economic management of the situation, especially in the first 2 months, March, April, and May.
Continuing with your experience in Selangor, Rajiv, parts of Selangor, though not your constituency, were made to comply with enhanced lockdown measures more stringent than the general MCO. Can you tell us a little bit about what that looked like on the ground and the effects it had on those communities affected?
So the MCO, the general lockdown, means that you could only travel 10 kilometers from your house to buy essential items, but you could still move and you could still go to work if you were working in one of the essential services. Now, the enhanced lockdown was a real lockdown. There was barbed wire around the area. You could not leave your house. No one could come in. So you could not get any deliveries of any kind coming into your house. You could not leave your house to buy anything. And this was made necessary because these areas had extra spikes in cases. So in PJ Old Town, that is partially in my constituency, there was 26 cases from the PJ Old Town Market cluster, and that sudden spike in cases led the authorities to lock down this area. And what that meant was the residents in that area could not leave their house at all. So once again, as I mentioned earlier, it's always the speed of aid that matters. You need to deliver food aid on the first day itself because many people were struggling. You can't leave their house even though they have money. They can't buy food. So we needed to ensure that food was delivered. Provisions of medicines. People needed to get out for kidney dialysis, and they could not leave because of the rules of the lockdown. So there were some hiccups in implementing the lockdowns, but thankfully, by the second, third day, we managed to negotiate with the police to loosen up some of these rules so that people could get really essential things done.
Thanks, Rajiv. And to let our listeners also, those who are following, because during the early phases of MCO, we have the interstate, interdivision, travels were restricted within to 10 kilometers. And in the early part, even within the 10 kilometers, you are not allowed to move out. So Kelvin, so earlier on, Su-Lyn, Rajiv, they were talking about the aid, food aid, and all sorts of help that were given to individuals. And we do have the enhanced MCO, enhanced movement control order. So with that, what sort of aid has been given to individuals and households? Is it sufficient? What were the problems that you see?
I think there were food aid, as I mentioned just now at the beginning, that there were the state government as well as the local government, and also actually the federal government provided some aid. As Dr. Afif mentioned just now, there was cash aid through the Penjana and Prihatin program. Was it sufficient? I think it is never sufficient. Of course, there is no sweet spot in terms of cash aids. But then, as Rajiv correctly mentioned, it's not just about aid, it's about the speed of aid and the accessibility of the aid that has been provided to the people that need. So basically, one of the most common food aid that was provided by the welfare department, and then they provide basic food rations such as rice, canned food, bread, sardines, and stuff like that. Is it sufficient? It's sufficient to get them through the next few days, but then a lot of this aid came very late, many weeks after the restrictive order. And because of that, different people actually helped fill in the gaps. I think one of the most important lesson that we want to share with the world is how communities, not just government agencies, are part of this fight. This has to be a whole society approach. So during this whole gap, state government stepped in and something NGOs and community initiatives stepped in. So there were many community initiatives, like in my constituency, that they came up and says that let's do something for our own. So they raised funds, they made their own PPEs, they 3D print face shields and different things like that. So that is that's how certain gaps are being filled. But then again, I think the government should look at a second batch of aid because the economic impact could be, it's a marathon, it's not a sprint. So the economic impact may hit again in October and end of the year. So we have to be prepared and proactive in addressing that.
Right, thank you, Kelvin. I think on the economic impact of we'll just give an overview. Probably Afif can also chip in as well, because we are projecting about 800. Currently, I think we have 800,000 unemployment in Malaysia. We are going to look at about 7 to 8% of unemployment in Malaysia. So we have one question for our participants. So I'll bring this to you, Afif. So how do you think we, especially the youth, can lessen the impact of economic gap post-COVID And if I'm not wrong, you are also part of the Ministry of International Trade and Industries. And now that many of us are receiving pay cuts, unemployed, how do you think that the youth can help?
So I think what we notice from the industry players and also the stakeholders when we engage with them throughout the period, during this period since March until now, there are increasing demand for new workers actually by the local industries, especially with the effect of no foreign workers being able to enter and also to join the industry. So this is the challenge where we have to not only change the attitude but also the approach to encourage more local youth to be able to join the workforce in these industries. For example, we had recently to one of our automotive producer in Malaysia, the national second automotive industry, which is ProFellows, mentioning that they need another at least 2,000 workers to be employed during this period, in order for them to maintain their line and also their production line and their business. So this is where the challenge that we face now, and also to find where government have come up with some measures to reskill and also to enhance the knowledge of our local youth who is out of job to be able to re-enter the industry. So we've come up with some policy to allow that to happen. With the help from the Human Resource Ministry, where we have now starting the campaign of re-employment throughout the nation in order to encourage more youth to be able to join. Besides that, under the Ministry Malaysian Productivity Commission, MPC, we have come up with a program to educate especially the youth and also the entrepreneurs on how to go digital. We've been campaigning about this for the past few years. I think most of us here knows about this. But due to the MCO and COVID-19, businesses are forced into to go digital and also to go online in order for them to survive. So I think this is only the act of survival for them. So it is I would say it's a blessing in disguise for the businesses in order for them to enhance further their business by going digital. And we have set up quite a number of programs that will be able to help out, especially the startups to be able to go digital and also to do it online. And we've seen it even at the community level, even as simple as the usage of a WhatsApp app that will be able to allow businesses to take place. And, the approach that the government is taking now, we want more domestic economic activity to be happening. We want people to spend money, because in order to face these challenges, those who are in need, we have to help out. But those who have a bit more of disposable income, we are encouraging them to spend so that the economic activity will be able to circulate and also to rejuvenate the whole economy itself in the midterm and long-term period.
Thank you. So moving on from the economic impacts, which there are many, earlier Su-Lyn talked a little bit about some of the overlooked impacts, especially pertaining to those afflicted with other illnesses and their ability or inability to receive treatment. But there's another aspect which Kelvin brought up to me in an earlier conversation, which is the mental health aspect. So Kelvin, you caught COVID-19 and were an asymptomatic carrier. Can you tell us about your experience and explain more broadly the mental health implications related to the outbreak and its response, and also their consequences?
Thanks, Pete, for the question. As correctly pointed out, I caught the virus in the month of March. And because of that, I was quarantined. I was hospitalized for actually a week because I was asymptomatic. I wasn't displaying any symptoms. So actually, they did not prescribe me any specific medications. I just had to boost my immunity to fight the virus. But besides the anxiety that I go through, I'm grateful that I did not go through much on the physical side, but many other patients had to go through the anguish and the anxiety of their own health and their own physical health. So on top of your worry and anxiety for your own your own life or even your own health conditions, a lot of these patients, even myself, face what we call stigma from the community because of getting this virus itself. I always joke and say that COVID-19 is the modern day leprosy. The fact of the matter that if you mention that I was a COVID patient or I was in contact with a COVID patient, people run miles away from you. And not just running miles, but sometimes they throw out toxic and non-constructive comments that actually has an impact on the mental health of the patient itself. And it's not isolated or limited to the patient, but also the people around them, the family members and stuff like that. My family went through stigma as well. In my father's workplace, things were mentioned towards him as if we wanted this, as if we are creating trouble or we are endangering the lives of others when we did not want this. So again, as I said, mental health will be the next pandemic. It is not just the disease itself on the health side, but the economic impact that we're going to feel comes hand in hand with mental health. People that have pre-existing conditions of psychiatric conditions, of anxiety, depressions, in most cases is aggravated due to this. I think one of the biggest struggle, like as a patient I went through, was what we call the spreader's guilt. Look, nobody wants to get this disease. Nobody wants to spread this disease to another person. So one of the most difficult thing that I had to go through was to read the daily report to see if from myself, were there other people infected? Because even though we tell ourselves all the time, it's not our fault, we didn't want this. But there is a certain level of guilt that we carry if it affects other people, and even worse, if somebody passes away from it. So a lot of, I've been advocating for how we can protect the mental health of these patients a lot more, especially in terms of reporting by the Ministry of Health, how certain reporting shouldn't stigmatize or build a perception as if that patient is the source of the infection. I mean, in Malaysia, one of the ways that the Ministry of Health do their reporting is through what they call a tracing tree. That means they form the source, then they trace the one this. I understand this information is very important in terms of epidemiological studies and also contact tracing, but I question the rationale of showing such charts to public, because the perception will be everybody starts blaming that. And if you look at the comments on social medias, and it's very clear, people claim that these are killers, these are super spreaders, these are sinful people that are causing all this harm. So again, I don't blame a lot of the public, because people fear what they do not understand, and sometimes we do not explain in detail what, for example, what's an index case and stuff like that. So there were major clusters in Malaysia. I can name up the UDA cluster, the Tabligh cluster, the Sentosa cluster, even now to a certain level, the Sivaganga cluster, where you see so much of blame, so much of toxic comments aimed at the different patients. So that is something that we really need to deal with. Mental health is the next pandemic. As I said, we really need to address this issue. Many of the patients, I have a small support group that call me and say that, Kelvin, how do you deal with it? How do you deal with this? I'm going back to work, and then they find it very difficult to work with the same colleagues that have said all those mean and toxic things before. So this is something that we really need to address, not just the physical side. We need to make sure people recover on the physical side, but also the mental health. Because as I said, we need to rebuild our country economically, and statistics have shown that if our mental health are not taken care of, productivity decreases. So in order to rebuild this country, this is where the government needs to look into also providing adequate, sufficient, and strong support to make sure productivity of these patients and patients around increases, so that our economy can be built again. And that we need to handle the mental health issue and the mental side of things.
All right. It's also great to see that you have recovered very well. So Kevin, what do you think about that the government can do differently in the future to avoid unintended consequences of these policies on treatment of non-COVID diseases and illnesses?
Sorry, can you repeat the question? For treatment of non-COVID diseases, is it?
Yep. Non-COVID diseases, we have non-communicable diseases, access to cancer, or even like earlier on, Su-Lyn did talk about the mumps, rubella, and polio. Even in the midst of the COVID pandemic, we have rise the rise of dengue fever as well. So what do you think about that, Kevin?
I think as very rightly pointed out by Su-Lyn right at the beginning, actually this is one of the issues I've been raising up in Parliament in terms of the government's approach to deal with non-COVID patients. I strongly believe this pandemic actually shows the strong need for us to invest more into public health, to prepare for not just the next wave of COVID, but trust me, this won't be the last pandemic that we will face. We know that prevention and treatment services for the biggest problem, in my view, the world is facing, which is the non-communicable diseases, diabetes, hypertension, and stuff like that. All this treatment are disrupted due to COVID-19. So a lot of the MCO has restricted a lot of access to healthcare for certain people. Some people don't dare to come to the hospitals because of fear for COVID as well, and this has disrupted a lot of their treatment. I think there is a survey that said that more than 7,000 elective surgeries has been postponed. Again, elective surgeries are not
52,000 surgeries.
Okay, sorry. So again, these are not emergency surgeries, these are elective surgeries. Even so, a delay of such surgeries actually worsens the prognosis of their patients. So recently, the Minister of Health have answered my question in Parliament saying that so far they have not monitored any increase of death or mortality from non-COVID patients, but trust me, it will eventually come, or maybe that data is not is captured yet in the official data. So what actually I felt the government should have better addressed this issue, as I mentioned before, was the unified healthcare network. The one source of potential or strength that we did not capture was the private sector. A lot of the GPs was left out from being involved in this. Actually, the GPs could have played a huge role, especially in screening the community. I fully agree with Su-Lyn in the sense that the more we test, the more we will find cases such as that. And actually, one of the questions I asked yesterday to the Minister of Health in Parliament was, did they see a change in characteristics of the virus, especially the people that they affected? In the US and in the UK, in most parts of Europe, they have seen that there is a decrease of the median age of people being affected. That means more and more younger people are being affected. So I asked whether they have seen this in Malaysia. What is the implication? If more younger people are affected, that means in most cases, these younger people are asymptomatic because the immune systems are better. And if we are seeing an increase in young people's infections, then should the government strategy then refocus? So currently we are doing targeted testing. That means people that show symptoms, close contacts and stuff like that. But if we are seeing a decrease of median of age, we should change it to detect more among the community, to detect hidden clusters. The fact in Kuching, I can share it. The biggest cluster in Kuching right now is the Sentosa cluster. That cluster was found because the index case doesn't mean the source, but the first person to be tested, went voluntary to be tested. And because of that was discovered, that whole cluster of 31 patients was discovered. That means if that person did not voluntarily go test, that whole cluster will remain hidden. And as you know, we delay it longer, there could be more aggravated consequences. So with the decreasing of median age, with the changing of characteristics of these whole diseases, the government should be proactive in formulating how they should change their testing capacity, their testing strategies, their testing aims and stuff like that. And most importantly, involve the private sector. There could be a unified healthcare network where the private sectors will work on non-COVID patients. They can even mobilize doctors from the government sector to use these private facilities. So again, it has to be a whole community approach, not just the public healthcare sector.
All right, thank you, Kelvin. So
I just want to add on to what Dr.
Sure.
Yii said a bit. So it's not just cancer treatment and surgeries that were affected during the lockdown, but even ordinary services like diabetes and hypertension management. 1 out of 5 adults in Malaysia have diabetes, and a lot of the government clinics and hospitals are used for COVID. And it's not just preparing so of course testing is one issue where we have to increase, but there's also not just protective gear that we have to prepare for future outbreaks. There's also labs, support services like imaging services. Are all these well distributed in other states outside KL, like in Sarawak or in the East Coast? Staff training, do we have enough government doctors who are well trained instead of just sending fresh medical officers who just finished their housemanship to major COVID hospitals, which is what we did. Yeah.
Yeah, thank you, Su-Lyn. So we'll come to the questions. Yeah. So Afif, would you like to add a few things? Yeah.
I think what Kelvin and Su-Lyn have raised, I think, is crucial for the policymakers, especially at the ministry level in MOH, to be able to understand is that it's not only about enhancing the service, but I think the incorporation of technology and advancement in disease prediction and also to be able to study the disease better. I think this is where MOH has not been able to do it, I would say, a good job in it. This is the challenge that we have in Malaysia, because our database is still, to a certain degree, still collected manually, I would say. And this is where MOH has to really transform to be a fully digitalized ministry in order for us to put in the advancement of artificial intelligence and disease prediction in order for us to understand and to come up with a better policy which is data-driven and scientifically backed by facts and figures rather than just sentiment and also experience that we have before.
I think in response to what Dr. Afif said, so it's not just, I mean, it's great if we have like more modern technology, but even simple things like revealing the clinical characteristics of Malaysian patients with COVID, the private clinicians complain that they don't know, they don't know what a Malaysian pregnant woman with COVID looks like, whether there are any gender, age, racial differences. So you don't really need high-tech stuff to reveal all the information to the public. I mean, I think the public should have access to this data, but if you don't want to give this data to the public, at least give it to the medical fraternity, because they see half of our healthcare expenditure is in the private sector.
Yep.
Right. Thank you so much, Su-Lyn. So I think I have a question for Rajiv. I mean, just now, Kevin was talking about mental health of those who have been affected with COVID-19. But also in the midst of this COVID-19, there are also a lot of young people who are unemployed. And we recently have a case of a young unemployed, 28-year-old unemployment. He was unemployed and he attempted to commit suicide. And in Malaysia, if you attempt to commit suicide, you can be fined or jailed. So in the case of things like that, what do you say about that? Should things be changed and how we approach on helping people dealing with mental health issues, including suicide attempts in the midst of pandemic?
I think Kelvin is far more equipped to talk about dealing with mental health than I am. But it is true, the economic stress is extreme. And I think it's not just the young people. Maybe the young people have lesser financial commitments. I deal with the constituency of many middle-aged families who have far bigger financial constraints, commitments, and it's very difficult for them to navigate this sudden disruption. Now, this is not self-inflicted disruption. A lot of these people have lost their income, not because they are lazy, not because they refuse to adapt, they refuse to work on improving themselves. A lot of people are in this quandary because of government-imposed measures, which were necessary to deal with the virus. So widespread, everyone involved in tourism, they are suffering. Everyone involved with foreign students coming in, they are suffering because foreign students are not coming into Malaysia, and many other sectors of the economy that is reliant on exports, and those exports can't be made as much as before. So the government, I believe, has a duty of care to help people navigate through the situation. People shouldn't be driven to such stress to commit suicide. There's one angle of helping people deal with their mental health, but there's also the other angle that the government could give a better safety protection net for these people that are in dire straits.
Don't mind me adding into that. So basically, as mentioned just now, a lot of economic uncertainties and difficulties will come in hand in hand with mental health issues. And one of the things that we are pushing very strongly in Parliament is for the government to actually decriminalize attempted suicide. Section 309 of the Penal Code in Malaysia, basically, as Norman pointed out, says that a person can be fined or thrown in jail if they attempt suicide. In my view, this is a very draconian, it's a very outdated law, and we need to be proactive to give the necessary support encouragement to these people rather than throwing them in jail, which will aggravate their conditions. And I foresee an increase of such cases. This year itself, actually in early of March this year, there was a patient that was under observation for COVID-19 that committed suicide. In April of this year, a 20-year-old man in Sarawak attempted suicide because of the MCO, because of the restricted order, that he lost his job and he could not return home to his village, and because of that he attempted suicide. In June this year, a 42-year-old man actually attempted suicide because he lost his job due to the restrictive orders. And trust me, this trend will increase. And again, the common theory is that with one reported official attempted suicide, there will be 2 or 3 behind that are unreported. So this is something that the government must be proactive. They deserve our support, therapy and treatment, rather than being thrown into jail, treated like a criminal, which will create more troubles for them.
And we have one question from our participant too. I'll bring this up for Su-Lyn. So there are a lot of people living with disabilities worldwide, and well, medical services are concentrated to treat patients with COVID-19. As a result, people living with disabilities, those who need all these medical, they are not met. So the viral outbreak also adversely affect their livelihood, and people living with disabilities live in developing countries depend on livelihood on informal sectors such as street food vendors, handicraft makers. So in your view, Su-Lyn, so what policies have been implemented by our government to address those issues?
Well, if you're talking about economic aid for the disabled, I think Dr. Afif or Mr. Rajiv are better suited to answer that. But I can say though, since the government does sometimes, actually all the time, like to use threats to compel certain behaviors. And when our cases started going up in the past few weeks, the government kept talking about how, it might impose another lockdown, another strict lockdown, which I feel is totally irresponsible. And that's not the way to motivate people to follow social distancing or wearing a face mask. Let's face the facts. We cannot have another lockdown. We will die. The economy will die. People with disabilities, informal workers, those with other conditions like cancer, diabetes, and whatnot, they will all die. We're not seeing it. We're not seeing the numbers yet because, it does take a while to die from cancer, I suppose. But we'll see it later this year. So the government really needs to stop talking like that and start treating Malaysians like adults who can follow guidelines if they were educated about it and if they saw good examples from politicians themselves.
Thank you, Su-Lyn. So probably we will get Afif just very briefly because we were looking at the time. So Afif, maybe you can share a little bit about what can we help, what the government can do to help the people living with disabilities.
So now I think that's why at the grassroots level, most of the people who live with disability is already under the list registered by the welfare department. So there are measures within the department that will be able to help them out. But we also have to be more proactive. The officers are instructed to be able to go and monitor and also to engage with all those within the list. But what is more crucial is that to identify more who are facing these kind of challenges in this period. Not only during this time, but I think with the effect of MCO and also the COVID-19, like I mentioned earlier, it's not only about getting the government to do what they have to do, but also as a citizen, we have to be more proactive in order to channel these kind of issues to the government effectively. So I think at the grassroots level, the community associations, residential associations, and also even as a citizen ourselves, we have to be more aware of our surrounding and what is happening within our community. With that, I think this complementary effect between the government and the community has to really take place. I do agree with Su-Lyn to a certain degree that there are times where we feel that it's a bit overboard to go with the implementation of some of the restriction that has been implemented by the government. I think these measures has to be taken in order for us to look at the greater good of the whole community itself. I think this is the challenge that we have to face for the next probably few months or even to a year, especially if we are facing with the second wave or third wave of this pandemic until we really get the answer to how be able to curb this pandemic. But I think what we can also do better is that we have to learn from other countries who has been successfully implemented their lockdown and so their measures of control, and also to be able to implement it here. And I think the next months to come, the bigger challenge would be for us to answer, especially as policymakers, is that whether we're going to allow the free movement of people across the countries, which Malaysia has not implemented to a certain degree. And as you can see, even when Kelvin mentioned about Sivaganga, you know very well that the case came because the particular individual who actually returned back from a foreign country back to Malaysia did not abide with the quarantine that has been imposed on him and has caused this new outbreak in the state of Kedah, who has been a green state for quite some time, even during the MCO period. So this is, I think, where the government has to balance out whether it's about not only about protecting the individual rights, but also whether this will cause detrimental effect to the society and also to the community. So I think this is where you need more views, more deliberated discussions on whether we're going to allow free movement between nations. Let's not talk about whether we can travel back to the US or the people of US can come back to Malaysia to travel. Let's just look at with Singapore, they're going to be open up very soon, and then with other countries like Indonesia, Thailand, which is the nations within the Southeast Asia nation, which there's a lot of movement of people daily that's ongoing. For example, before MCO, we have more than 1,000 patients, medical tourist patients that comes to Penang daily from areas like Medan and the northern Sumatra to Penang. So I think this is where, and these people do not come for tourism, they come for medical needs. So these are the issues that we are discussing now, whether we're going to allow that to happen, because we have totally a different approach of lockdown and also ways of measures of curbing COVID-19 compared to Malaysia and Indonesia at the moment. So these are the challenges that we have. And I think there's still a lot of things that need to be learned as we progress to understand the whole pandemic as a whole, not only on the virus itself, but also the policy on the economy, the policy on how we tackle other issues, social issues, that the unintended consequences that happen due to this COVID-19 pandemic.
Thank you, Afif, and thank you to everyone on the panel, Assemblyman Rajiv, Ms. Su-Lyn, and YB Kelvin, and thank you to Norman. We've run out of time, and I think we've covered a lot. So I'd like to thank everyone from the panel. I'd also like to thank everyone that viewed this panel from Malaysia, from the US. We really appreciate your questions, and your input, and I think it went really well. Thank you, everybody.
All right, thank you.
Thanks, Pete and Norman.
Bye.
Thank you.
See you.
Bye.
Stay safe.
Bye-bye.